Smile, you're gonna love your fabulous Westermeier Martin smile.
Westermeier Martin Dental, as you know it today, started a long time ago, almost 75 years ago, with my dad. His office ultimately overlooked Cazenovia Park, and it made it very pleasant for people, which was somewhat the idea of what we started here in 1982 when we built this original building. He was still in practice when I started, obviously, and he was still in practice when Scott started. So at one time there were 3 generations, which is very unusual.
I'm excited about where it's going, but Grandpa and Dad set the stage for kind of setting the pace for that kind of mentality of practice, which I have to give them all the credit for, because I don't know where I'd be if they didn't do that.
We're very compassionate with people. Nancy and I love people, and one of the best things is when they do come in the office and you see they're hiding their smile behind a hand, you know, they're looking down, they don't have the confidence. We really want them to understand that we are going to give them a great smile.
And when they see the final results, I mean, we've cried with patients this morning.
Yeah, I know.
You know, because they just can't believe that they can get this extreme results, and it changes the way their appearance, it changes their attitude and their outlook on life, and they stand a little taller and
smile more.
Yeah, yeah.
There are a lot of high fear, anxiety patients that come to most dental offices, and we do have a great ability here to help those patients become comfortable with dental treatment, whether it be a cleaning or procedure with the dentist, and help them to understand what's going on, to get through it, and be able to come back with a sense of ease.
The reason that the first exam is longer and it costs more is because it is so comprehensive. Once we have everything determined, it's more, if you have things that you're watching, like if you come back 6 months later and you have a regular exam done, a periodic exam, that is a little easier because you've already seen the person, you already have everything marked down. If you have things that you're watching, it's already recorded in the computer.
We just really try to make our patients feel comfortable. We try to get to know them on a one-on-one basis. You know, about their children, grandchildren, hobbies, likes, dislikes.
As Patty said, we tried to talk with them about their family, touch base with them on a personal level, because that's important. We need to create a relationship with our patients for them to continue to come to our practice.
Most people have questions about the ability to pay and how do we deal with their insurance benefits, what kind of financial options we offer them. And we actually have some very nice options. We offer a very nice payment plan that usually can fit anybody's budget. Some of the payment plans are interest-free. We also have an extended plan for people who have major work that needs to be done. We try to make it affordable for people so that that's not an obstacle, so that they can actually get what they need to get done. So they can get their mouth healthy and they can get their smiles back again. That's our #1 thing.
It's a passion of mine to treat people the way I'd want to be treated. I built an office that I'd like to come to because I have to live in it 8 hours a day. So I built a real nice office with Jeff, and we designed the rooms in such a way that's very unhospital-like looking. The music's just right. We pay attention to the temperature. We put a TV on the ceiling to distract people because nobody really wants to go to the dentist. I take it as a complete challenge to make it as pleasant an experience as possible. So we see too all those little creature comforts, the way people are treated, the way people are talked to. It really is a different experience, and when people come here they tell us that all the time. And I love to hear it because that's been my mission, to make it a wow and a pleasant experience to get your dental care done here.
We feel that we've gained so much education where we can bring somebody in here who feels hopeless, who feels like their teeth are just gone, all they could do is get dentures, or maybe they already have dentures, and restore them back to how they want to be, give them their teeth back. Literally every day there'll be a patient that'll give us a hug just because they're so thrilled that with their teeth, with their smile, that they can chew, they can go out to eat again. That's really the driving force behind what we do here, and we're very passionate about making sure that every patient enjoys their visit here.